DeKalb County has recently partnered with the Georgia Department of Family and Children Services to help re-enroll hundreds of DeKalb residents who have lost their Medicaid insurance. The event, held at the former Sam's Club in Stonecrest, was put on in collaboration with Emory Healthcare, Peach State, Peach Care for Kids, CareSource, and Amira Group. DeKalb CEO Michael Thurman says it's important for the county to get involved in this life-saving enterprise.
So we are standing in the gap, making sure people who are qualified or signed up, getting what they need so that they can protect their health and the health of their families.
According to KFF, an independent source for health policy research, nearly 2.5 million Georgians are enrolled in Medicaid. Their research also showed that uninsured rates in Georgia are higher than the national average, a trend that has continued since 2013. The event aimed to enroll more DeKalb residents in Medicaid and re-enroll some of the 500,000 Georgians who had lost health care coverage and were unaware of it.
The majority of these folks are Black and brown people, and a significant proportion, more than 70%, are children. And so it's important that we make sure our citizens are protected, that they have options for health care, and that, we keep the county safe.
Dr. Elizabeth Ford, healthcare advisor to the DeKalb CEO, emphasized the importance of this event amongst other issues impacting Atlanta's current health crisis.
As we talk about the hospital closures that are happening in Metro Atlanta and the overburdening of Grady, 500,000 people with no health insurance is only going to make that situation worse. So this is an effort to make sure that not only we keep our residents insured, but that we relieve the pressure on the hospital system and make sure that folks are covered.
Primary care providers were also in attendance to help inform residents of healthcare options outside of hospitals in the Metro Atlanta area.
We have 20 locations throughout the greater Atlanta area, and a lot of our practices are co-located with Walgreens. That means we're on the same footprint, and that allows our patients that see us, if they like, to be able to get their medications at the Walgreens. We're in primary care, but we can help our patients coordinate and look for specialists in their network. Because we're not bound to any one network, we can work with all of them.
For those that have missed the event, there are still several ways to enroll in Medicaid in Georgia. You can complete an online application at either Georgia Gateway or healthcare.gov, call the Division of Family and Children Services information line, and be directed to a local office that can help you. You can also contact your DFCS county office and ask them to mail you an application. You can return it by mail, fax, or in person.